Good afternoon, and thank you for allowing me to come into your centers on Zoom or on this Teams webinar. I am an RN. I've been a nurse for 60 years. 45 of them were spent in the hospital setting and approximately 30 of those were in management and administration. Since 2008, I've been in the ambulatory setting, and I have been a consultant and conducting surveys as an accreditation surveyor since 2010. If I have surveyed your center in the past 5 years or consulted with you and have probably heard most of what I'm going to discuss today, I apologize that some of the slides have a lot of wording on them. They are the standards that the surveyor may ask for in writing and in documentation, but we're also going to talk about the process that you are following to understand the purpose and implementing the process for ensuring your employment of licensed, certified, educated, trained, and competent staff, and meeting the regulations and requirement established by regulating and accrediting agencies. There are approximately 5 or 6 different agencies out there, and you have a choice as to which one you want to use. Next page. The biggest issue that I hear from managers when I am working with you during a survey or working with you as a consultant is dealing with staff and dealing with staff's ability to perform their duties and to work as a team without conflict and to do a positive work environment. So I'm going to kind of walk through the steps that I speak to for conducting the hire process, and it all begins with the interview process. You need to establish your purpose for the position that you're filling, and when you prepare for your interview, decide what you want for the position. This doesn't mean that you just want to fill a position with a body, but you want an employee who provides the services most important for the patient to have an exceptional experience and to understand your philosophy, the services that you're providing. You want to establish the questions to best obtain that information, and you want to make them difficult. You don't want to have them as just one-word answers because you don't truly get the information that you need. I always speak to the fact that you're not training the employee to be an RN, a certified scrub tech, a rad tech, or a sterile processing department person. Your qualifications should already be in place or you wouldn't be interviewing the person. You're finding out if they are the type of person you want working in your employ. And this is your opportunity to shape the employee for the type of performance and work ethic you expect to provide a positive work environment and to get the highest quality care that you want provided in your center. Next slide. Once you've completed, so with the interview process, one of the things that I've identified is that you're being told by the employee. Have you ever wondered after you had an employee working at the bedside who the person was because the interview that they gave you was so much different than the person that you're working with? You review the job description to make sure that they understand what your expectations are, not only for your work ethic and providing a positive work environment, but for the ability for them to care for the patient and work as a team. You provide the orientation and training consisting with the review of their competencies for the care provided during the patient's visit. You provide the processes which enable the employee to perform the tasks required, and you provide the equipment needed to perform the work involved. After you've done this, you're now dealing with behavior. Are they performing at the level that you have expected? And if they aren't, you review one more time their competencies and their understanding of their job description, and then they choose to either work for you or they choose not to work for you. Next slide. Your responsibilities after you have hired the employee, you've trained them, they're working at the bedside. One of the requirements that every surveyor is going to ask for is, have you performed performance appraisals for your employees on a consistent basis? Many of you have 90-day evaluations to ensure that they've understood what it is that they're supposed to be doing. Many of you do a 6-month evaluation. Most of you do an annual evaluation. The requirement by CMS and by most of your accrediting agencies is that you do an annual performance appraisal and you have documentation of it in their employee file. During the performance appraisal, you're going to review current performance, set goals for the coming year. You're going to review with the employee that when they come, excuse me, when they come to work every day and they complete their work according to their job descriptions, they're consistently meeting. What are they doing over and above their regular job description to exceed? Is the employee performing to your expected standards? Do they work together as a team? Are they completing their tasks to the ability you expect of your patients, for your patients? And are they a good team member and they foster a positive work environment? When you have completed the steps for setting expectations, reviewing job descriptions, conducting orientation and training, and including the competencies for the tasks expected to be performed for each and every patient, you should have a staff who provides a high quality care to patients who are extremely satisfied with their visit. Next slide. The process for employment, when conducted as an intake of the applicant's ability to perform within the parameters set by your organization, which are established by the standards that you've identified that you follow. If you follow ARN, if you follow CDC, if you follow CMS, you need to help the staff understand what those are, and they should be beneficial for you establishing your expectation of their ability to work with all employees, to foster a positive work environment, and to deal with conflict in a professional and respectful manner. Understanding the employee's previous work ethic is difficult as you're getting your information from the applicant during the interview. And many times as a manager, I have asked for the applicant to bring a copy of their last performance review with them for discussion during the interview. Now, I've had some pushback because they don't understand why I want it. If they are a good employee, they don't mind bringing it. If they are a marginal employee, they may tell you that they didn't get one with the last evaluation, that they haven't had one for 2 or 3 years, which some managers are not as consistent with giving them. But talk about how they performed, how did they address conflict, how do they address if another employee isn't working with them, because you want to make sure that you're providing the best environment that you can provide. Once the employee is hired, you complete the following steps. And as a surveyor, we're going to ask for the documented review of the written job description. And I always suggest that the supervisor reviews the written job description with the function and responsibilities as defined, and as the authority and qualifications, including licensure and certification, the review of your defined competencies outlined for the care. So that means that you have developed for in your center the different tasks and competencies that need to be completed for the preoperative area, the intraoperative area, the postoperative area, your SPD. What is it that you expect of your employees? Because if you don't review that with them, when you try to evaluate them, or if they're not doing their job, you can't discipline them if they don't understand what your expectations are. So you need a signed and dated review on hire, and you should really have one on an annual basis where you review the competencies to make sure that they're still complying within the standards that you're setting. Next. The processes you're completing is performed to ensure compliance with the requirements defined by the government, as well as those outlined by the accrediting agencies you have chosen to utilize to ensure high quality outcomes. We've identified that navigating the world of ambulatory surgery centers documentation can seem very daunting. Three of the regulatory powerhouses stand out in the field. Number one, the Centers for Medicare and Medicare Services, CMS, really sets the tone for all of the other accrediting agencies and the standards that they set their parameters around. The second is the Accreditation Association of Ambulatory Healthcare, and the third is the Joint Commission. These bodies govern, audit, and determine the guidelines for how you maintain and store critical health information in ASCs, including meeting documentation requirements for ensuring your staff have received the education and training outlined and defined to meet the mandatory and recommended established standards. Your responsibility is to make sure that you understand the standards that you state that you follow, and that your staff understand and are trained to comply with those standards. Next slide. CMS sets the standards for proper ASC documentation, which is more than an exercise for mere compliance. Meeting the regulations provides a critical tool for promoting individual patient outcomes and plays a significant role in the broader health environment. As healthcare professionals navigate the patient intake, surgical procedure details, post-operative care, and H&P documentation, they address the challenges along the way. And you find in your documentation and in your understanding of what needs to be completed for the compliance for the of which has been set. The purpose is for harnessing this wealth of data for improved health outcomes, which becomes increasingly clear. So you, as an administrator, either are responsible for the quality and the infection control, or you have somebody that is responsible for it, but you use this data in reporting your quality outcomes and monitoring the many quality components needed to ensure your high quality, cost-effective, and safe care is being provided. Next slide. Have you conducted the orientation and training outlined by CMS, HHC, and/or the Joint Commission to meet the required documentation as outlined in the different guidelines and standards? Basically, this is an open book test. CMS provides the Ambulatory Surgical Centers Appendix L of the State Operations Manual. And in this manual, it identifies what the CMS requirements are for education training, what's going to happen during a survey, and what you need to look for. HHC has their standards handbooks, which this year's is the B43, and they have them both for the ambulatory accreditation, which is the non-Medicare deemed, and then you have the Medicare deemed status, which is those standards that are a little bit more stringent and crosswalk with the CMS standards. The Joint Commission also has the comprehensive accreditation manuals, and all of them give you a step by step for each standard for what you should have been written and approved and should be documented when you're educating and training your patients and when you're performing your care throughout your center. All of the standards are established to provide an outline for the care provided and to promote a high quality, safe care for all patients. Next slide. We're going to review the identified documentation that many surveyors are going to request. Now, some are more thorough than others, but all of them have the same electronic system that they have to complete so that the processes are outlined in policy and procedure and established to meet the identified guidelines. The standards reviewed define CMS, HHC, and or the Joint Commission's expectations for documentation. Now, the definitions here are similar to those from HHC. There are some in here that are from CMS, and I identified some that are specific to the Joint. But the definitions may vary depending on which agency you have chosen to be surveyed by. And again, depending on your surveyor, depends on how strict and how thorough they're going to be to ask you for the required documentation that you may have. There are approximately 7 or 8 standards that we're going to review. The first chapter standard is administration, and this category outlines the expectations of administrative functions essential to the direction and operation of the organization. This includes the day-to-day operations of an organization that influence the client experience and organizational objectives, ensuring systems are in place to facilitate effective leadership and individual development. Operational effectiveness ensures the organizations run efficiently while delivering high-quality, safe care with all providers and personnel providing care being appropriately qualified and supervised and available in sufficient numbers for the care that is provided. Next slide. This is just an example of the things that a surveyor may request during your administration out of your job or out of your employee files or in your governing board meeting minutes or your staff meeting minutes. All policies adopted by the governing body are appropriate for the organization given the services provided and the patients served, as evidenced by the maintained personnel files. And we'll go through some of the things that need to be in the personnel files, ensuring all staff employed possess at least the minimum qualifications, experience, competencies, and licensure and or certification required by their positions. Your written policies and procedures, as well as other documentation, such as, but not limited to, meeting minutes, educational materials, indicate that all reasonable steps have been taken to comply with the applicable laws and regulations established by CMS and or your accrediting agency. So as you go through your books, it speaks to which chapters need written policies and procedures. And then we're discussing today the documentation that proves you've oriented and trained your staff to be able to follow the standards and meet the standards that you have set and state that you follow for your care to be provided. Next slide. Now, this one is a very busy, but it speaks to the review of defined standards by which HHC, CMS, and the Joint ensure that there is documented evidence of review and compliance as outlined in the expected regulation. This one speaks to the written personnel policies, which are established and implemented to attain the mission goals and objectives of the organization. You need to have documented evidence the employee was provided an employee handbook on hire. So make sure that you have a copy of a signed and dated, because it needs to be done on hire, that they understand what their behavior and expectations are as an employee to your center. Written policies specify privileges and responsibilities for employment, including compliance with incident and adverse incident reporting systems. Now, CMS, this is a CMS initiative, and you have to have documented evidence that you have educated and trained your employees to identify an adverse incident or a near miss, and that they understand what their responsibility is to reporting that adverse incident or near miss. Written policies specify the organization's procedure for handling of workplace violence and aggression. And this is a new requirement by CMS, but every employee has to, there are videos out there. You can do your own training that you can pull off the website. Accurate accreditation does have the components that you need for all of these training mandatory requirements. Written policies require periodic appraisal of each person's job performance, including current competence. Written policies comply with prevailing laws and regulations regarding verification of eligibility and employment. This is your I-9 form. It needs to be signed, and it needs to be completed appropriately within 3 days of hire. It needs to be signed by the employee, and there needs to be a documentation of the administration who's responsible for having reviewed it. And your written policies define the status of students and postgraduate trainees if present in the organization. The guidance reference on the side speaks to the file containing employment relating items required by the organization's personnel policies, which would be a job application, a resume, a job description, verification of references if you choose to have those, the results of background checks, and employee benefit forms. Now, the results of a background check became requirement by the government after 9/11. So every employee needs to have a background check. File contains the evidence that personnel policies were made known to the employee at the time of employment, that you referred to the risk management program standards and state requirements for defining incidents and adverse incidents, and the organization may choose to keep the I-9 forms in a separate file because they've identified that if the Border Patrol comes in, you only want to give them the I-9s. You don't want to give them their whole personnel file. Next slide. You're required orientation within 30 days annually. And one of the things that I recommend, and it's in yellow on the bottom with the 3 stars, is that you would make a orientation checklist that included the verbiage that is identified with these 9 required orientation and training, and that you complete them prior to your new employee going on the floor and taking care of patients, so that you don't have to track them down and try to figure out whether they've completed it within 30 days, because it can be a deficiency if they haven't been trained within 30 days of hire. So you have orientation and training, which addresses the organization's statement of patient rights and responsibilities and associated policies and procedures. And this is a CMS requirement. CMS specifically in their L state survey guideline speaks to ensuring that you have documented evidence that your employees understand what the patient's rights and responsibilities are. The second is the addressing the organization's procedure for handling of workplace violence, and we talked about this. Third is the address of organization's safety program. the address of the safety program, including the exposure control training and sharps injury prevention. That includes the applicable fire safety and prevention practices that address the emergency and disaster preparedness plan, including the use of emergency equipment and supplies. That you address the infection prevention and control program, including bloodborne pathogens and other training required by OSHA. You address the risk management program, including training in the reporting of incidents and adverse incidents, and you address confidentiality and privacy, which includes HIPAA and FERPA. Now, again, we are looking, and we don't want to have to look through your staff meeting minutes. We don't want to have to look through different training. If you use the Accurate's program and you can print out a transcript so that you have documented proof that this is done on a on-hire basis, and then it needs to be annually. And annually does not mean that it is the beginning of one year and the end of another year, but it should be done within 12 months of the original training and then every year thereafter. Next slide. Your orientation training according to position description needs to be provided to all staff. So you have orientation and training, and there's mandatory things that you have to do for your registration people, for your licensed people, for your SPD, even for your physicians. There's certain documentation and education and training that you have to have for them. You need documented orientation and training that is completed within 30 days of employment, with the training being provided annually thereafter. The training is provided when there is an identified need, and the delivery of all training is documented and dated and signed by the employee. If you have an orientation checklist or if you have a competency checklist, do not allow the employee or you yourself to do a line from the top all the way down to the bottom with an arrow that just says, I did it all. There should be a check mark with the date that they completed it, because most of those competencies are done over an orientation period and not all done on the same day. And then if you have signatures for the person that is orienting them, which might be different than the supervisor, there should be signatures and dates appropriate for those people. It's like your documentation in your patient chart. If there's a line there, make sure it's filled out, make sure that signatures are dated, and that the employee understands what their responsibility is. Accurate Accreditation offers courses through medical physics training, and there is a website that she has on this webinar and that you have been provided to view all of the courses available. Next slide. Now, this standard is your emergency management standard. It's a very busy slide. The emergency management category defines the expectations for ensuring that the organization is prepared for both natural and man-made disasters through all hazard approach. So there needs to be documented evidence that you have a hazard vulnerability assessment completed, that your organization is prepared to assess, respond, and manage potential threats that have been identified by that assessment before they occur. All hazards approach is an integrated approach to the emergency preparedness that Medicare, Medicaid, I outlined in June of 2016, a guideline for your emergency management plan. If you're having a CMS survey, if you're having a JACO survey, if you're having a AAAHC Medicare Deemed survey, they are going to go step by step through the emergency management plan, and you need to have documented evidence that you have reviewed and that you have completed your orientation and training for your staff in regards to this plan, that you've personnel files have the current training to respond to any of your identified disasters. Your personnel files, you need to identify within your center who needs to have BLS training. Does your receptionist, or is it only clinical people? Who needs to have ACLS training? Is it all RNs? Is it your anesthesia providers? Do your physicians supervise any anesthesia of any type? Your personnel file needs to include documentation of current BLS training, and CMS requires an American Heart Association hands-on training or one similar, but it has to be hands-on. It cannot be a computer program that there is no hands-on training, and you have to have documented proof of this. You have to have documented proof of training in the use of your cardiac and all your emergency equipment and supplies. Your staff should be monitoring your emergency cart. They should have understanding of the responsibility not only for the AED or defibrillator, but is your suction a battery operated or is it just electrically powered? Do your laryngoscopes have the correct blades that fit on them? Are your batteries not outdated, and is there no corrosion to them? All of those things can be a immediate jeopardy, which could prevent you from getting your accreditation and for continuing with providing care. A policy that requires that healthcare professionals with ACLS training are present until the day's patients have been physically discharged. Your policy needs to state who's responsible for being in the center and how many of them are there. And if you are a new center, you need to have initial documentation and training, and then you need to have updated documentation and training for not only your ACLS and your BLS, but your training and your CPR code and your malignant hyperthermia code. And if you take next slide, I think is the pediatric. If you care for pediatric patients, you have to identify how many staff in your center have to have PALS documentation. You need to have appropriate PALS equipment that is for the size and age of your patients that you're taking care of. You need to have training and age and size appropriate resuscitation for your staff, as well as that the equipment is present. So if you use a Broslow tape, it can't be a 2010 tape. It has to be the most updated tape because they've changed the process. So we're going to be looking at, is your algorithms up to date, or are your algorithms up to date, and have you done the training that's appropriate, and do you have the equipment that has been monitored and is appropriate for the size of the patients that are being cared for? Next slide. Again, we talked about following the CMS guidelines for your emergency management plan. You need to have a hazard vulnerability assessment. You need to have disaster preparedness training and testing that is based on that plan. You need to have a risk assessment, and you need to have a communication plan. You must meet all of the following training requirements, which were established. Initial training in emergency and disaster preparedness policies and procedures to all new and existing staff, individuals providing on-site service under the arrangement, and volunteers consistent with their expected roles. The CMS guidelines established in June of 2016 has a statement of whether you use volunteers or not. Some states have a volunteer registry. You can identify that. You can't just state that we don't use volunteers. Some centers try to state that they're going to close if there's an emergency. The problem comes from that is this is to identify whether you are capable and competent of doing care of your patients if a tornado or a hurricane occurred around you and you were not able to transport your patients out. You need to have your documentation of all emergency disaster preparedness training, and you need to demonstrate that your staff have knowledge of the emergency procedures. When the emergency and disaster preparedness policies and procedures are updated, there must be a training conducted and documentation of the updated policies and procedures. So make sure that you know and follow the steps of the plan. Do you have a waiver of 1035? And do you even understand what that is? Pull it off of Google, a waiver 1135, and see what that means for you and put a copy of it in your book. Next slide. Infection prevention and control. This is a big issue for all of us. And the CMS has specific identified areas that they require. And if you don't have training and education for it, it can cause you to have immediate jeopardy. But the chapter addresses the written program by which you define the standards established by the governing body, which follows the infection risk assessment, identifies the person that has oversight to the program, the training for your staff, as well as your physicians, your surveillance processes, as well as your education and training processes. Do you follow CMS? Do you follow WHO? Do you follow ANSI? Do you follow AAMI? What are the standards that you follow? If you state you follow AORN, what is your guidelines for your attire in the ASC, in the OR? What is your hand hygiene? And that includes your nails and your use of nail polish. The infection prevention and control category outlines the expectations for an infection prevention and control program seeking to minimize the infections and communicable diseases. The organization must adhere to the safe practices for patients, staff, and all others and maintain ongoing programs designed to prevent and control infections and communicable diseases while providing your safe and sanitary environment of care. The plan includes a written exposure control plan, which is designed to systematically assess your organization's practices and guide quality improvement activities. Both the infection prevention and control plan and the exposure control plan should be reviewed and updated at least annually and/or now, if you're having any construction, they also identified that you need to do the infection risk assessment for construction. And you need to have a policy that you know what that means, especially if you're having a deemed status survey. Your conditions for coverage must maintain an infection control program that seeks to minimize infections and communicable diseases. Next slide. Your documentation that your staff members have received infection control training should be documented on hire and annually, and your standard that requires the program should be directed by a designated healthcare professional with training in infection control. All of the organizations require at least a 5 or 6 hour education for infection control prevention by an ambulatory surgery center. And I know that the program that Accurate uses has that training program out there. AORN has one, APIC has one. You can find them, but you have to have documented evidence that the designated healthcare professional has that training. Your new employee needs to have updated training in prevention and controlling of healthcare associated infections and methods to prevent the exposure and transmission. So this includes the hand hygiene. Sometimes I'm dumbfounded when I'm observing in the OR or I'm observing care provided in pre-op or post-op of an employee dropping something on the floor, picking it up, not wiping it off, and placing it on the patient, whether it be an SpO2 monitor, whether it be a O2 tubing, whether it be a bag on an anesthesia cart. I've seen centers that store their positioning pillows on the floor and pick them up and put them on their tables, and you're contaminating the patient on a routine basis. Just be observant and pay attention to what processes might cross contaminate your patients. You need to educate your patients, your visitors, your staff as appropriate about infections and communicable diseases to reduce the transmission in the ASC and in the community. This is a Medicare requirement. Provide documented evidence of training and competency assurance of staff responsible for processing or cleaning of newly acquired medical devices. That needs to be documented. Next slide. Your requirements for staff members receiving training in infection control through one of the following methods is, do the staff, and they ask this in the annual review of your infection control program, as well as we ask it on, did you train them on hire? Do you do intermittent in services? Do you do an infection control training by computer? Do you do it by in-service? And how is it provided for other methods? The other question is, do all of your employees, as well as your cleaning staff and your physicians, receive the same training, or is it different? And they want documented evidence of the training that you provide. Do you know what your cleaning service follows for their standards for the cleaning within your center? Do you have documented evidence that you trained your staff on cleaning your before, inter-patient, and terminal cleaning for the carts, for the equipment, and for the supplies? Next slide. Again, Accurate offers these courses through medical physics training. Now, your laboratory and your radiology standards, your staff need to have documented evidence that they understand what responsibilities are for their role and that they understand the competencies for the tests that they're conducting. If you do blood glucose, if you do a urine pregnancy, if you do the HemoQ, there has to be documented evidence that they're competent to perform those tests on a higher and on an annual basis. You have established laboratory procedures which you follow, and that you have a process for obtaining, identifying, storing, and transporting your specimens. There is a written policy that is required, and your staff need to be educated in regards to it. Staff members with laboratory responsibilities demonstrate their understanding of their established procedures. When using radiation, anybody that is around the radiation equipment or in the room while it's being used, needs to have documented evidence of radiation safety training for staff and physicians. You need to have documented evidence of exposure monitor when appropriate. Are you using exposure badges? Have the exposure reports been reviewed on a monthly basis, and do the staff know what their exposure is for the year on an annual basis? Your documentation of the monitoring of the integrity of the shielding has to be completed on an annual basis. You need to have your calibration of your equipment documented appropriately. Next slide. Your medication management. All of you give some type of medication and have a pharmacy DEA or a pharmacy licensed by your physician or for your surgery center. And it is a vital part of the continuum of care, and your medication management is a safeguard against errors and aims to prevent patient harm and or death related to non-compliance with prescribed medication or drug interactions. This category applies to any organization that uses drugs or pharmaceutical medical supplies and samples, and regardless of the presence or absence of on-site pharmacy. They're going to ask you for a current list of your confused or your medications that have confused drug names, and they're going to ask for a list of the medications that are high alert. And they want not just the ISMP list, but they want those medications that you have in your center that are easily identified by your staff. And all of these medications need to be marked in your storage cupboards as well as in your anesthesia and your emergency carts as to whether they're high alert or confused drugs. Now, your high alert list should, because Medicare requires it, have a list of your reversal agents or antidotes on it as well. Many of the centers have a reversal agent kit with the medications listed as to what they're the reversal agent for. That also needs to be on your list, and it needs to be posted any place that you're storing your medications or giving your medications. Your medication inventory needs to be monitored to track the presence or absence of high alert medications, and also whether you have any expired medications in your center. And they ask if there's documented evidence of your staff understanding their responsibility for that monitoring and how they remove them or what they do with them if they are expired. Next slide. This is one. Go to the next one, please. Medication management. Your procedures are in place for the maintenance, cleaning, distribution, and use of devices such as nebulizer units, intravenous infusion pumps, or other mechanical devices used in the medication delivery process. You need to have documented evidence of who's cleaning those and how they clean them, whether the anesthesia is responsible for the propofol pumps, whether your staff is responsible for them. Do they adhere to the manufacturer's guidelines for cleaning of any of your equipment? Do you follow the manufacturer's guidelines, and do you have documentation present that your staff have been trained in the procedures? If you maintain vaccines in your center, if you do flu vaccines, if you do any other vaccines, you need to make sure that you're following the national recognized guidelines for vaccine storage, that CMS has specific guidelines, that your staff is educated for what they need to do if they are expired or if they're no longer maintained appropriately. The other is that your staff need to have documented evidence that they understand their temperature monitoring responsibilities. Why are they monitoring certain things? Are the temperatures monitored appropriately? For your medications that have temperature monitoring, you have to have documented evidence that your staff understands, like your succinylcholine comes out, it stays out and it's only good for 2 weeks. Your rock, if it comes out of the refrigerator, it's good for 60 days. Next slide. Safety chapter. The safety chapter, this is a very busy standard as well. The outlines the expectations for the safety program that seeks to prevent injury and illness and maintain risk and minimize the risk to the patient, staff, and to the visitors by ensuring a safe, healthy environment. You need to develop and implement a safety system that provides the patients that they is monitored and you minimize the risks. Your program should include a safety risk assessment and processes for managing identified hazards and potential threats. Now, what I did is I put on here the definition of an adverse incident that Medicare requires, that you have this verbiage in your policy for what an adverse incident is, and that your staff understands their responsibility to identifying this, an adverse incident or a near miss, and how do they report it. Next slide. We talked about the temperature of your items, your frozen, refrigerated, and heated, and your responsibility for ensuring that it is monitored appropriately, that there are logs that are documented, and that your staff understand their responsibility to it, as well as the newly acquired devices, and that you have a designated person for ensuring that your staff are educated on the appropriate use of that equipment. Next. Your fire prevention safety are addressed in the written safety program. You have policies and procedures to educate your medical staff, your employees, your volunteers, and other providers and personnel in fire prevention and fire hazard. The safety program requires fire safety, fire prevention, and fire drills. Your fire drills have to be quarterly. They can't be at the beginning of one month and the end of another month, and they need to be scenario based so that they are identified of what it is that occurred. What is the response of your staff? Did you pull the alarm? Because it's a requirement that you pull the alarm on every drill. Your program is maintained to assess and reduce the risks associated with occupational chemical exposures. They ask if you've done a hazard assessment of your chemicals and the education of your staff of the use in the workplace to prevent any skin or tissue injury. You want to reduce the risk of chemical exposures, and you want to make sure that you have a spill kit appropriately, that you have your worker training programs documented in the personnel files, meeting minutes, and other manner. Next slide. If you have a laser program, you need to have written policies and procedures for each device. You need to have documented evidence of each type of laser. You need to have your required laser safety program. You have to have a laser safety officer. You need to have the requisite education and training for laser use in the facility, including the specific information. The policies and procedures require that you have the follow the ANSI guidelines for cleaning of lenses, for making sure that you have the signs on the doors for protection, that you have the education of your staff for laser safety, and your documentation for ensuring that the eye protection and the need for use of fire prevention and equipment appropriate for the use of that laser is documented and followed. Next slide. Be honest with you, I just identified that this is a requirement by CMS for education and documentation in the employee file. The patient rights and responsibilities are reviewed and are provided, but I didn't realize that you had to have documented evidence in your employee file that all of your staff understood this responsibility. You need to make sure that the patient has documented evidence that they've been offered this prior to the start of a procedure. You need to have the staff who are responsible for advising the patients of their rights, your policies and procedures for providing such notice, and that your confidentiality of your clinical records has always been there. There's also a requirement by CMS that your grievance policies, that the staff are interviewed, that they understand that there is a grievance policy and that what is their responsibility to the difference between a complaint and or a grievance. Next slide. This has been an overview of the CMS, HHHC, and JACO requirements for documentation and training, which may be reviewed during your survey. I believe that I've identified as much as possible those things that I would ask for, and your responsibility for your documentation for orientation and training on a 30-day and an annual basis. The only thing I'm asking is that you ensure that you have clear documentation of the hire date, the date of completion of the required within 30 days and annually, so that it is of ease for you to provide for the surveyors so that it doesn't hassle you and it doesn't hassle them. Next slide. Okay, Marissa, are there any questions?
Let's see, guys. So you can start putting your questions in the chat and I will read those out. The first question was from Maxine. She said, will the attendees of this webinar receive a copy of the PowerPoint post-webinar? So Maxine, the recording from this webinar will be uploaded on the Accurate Accreditation website in the chat under educational webinars. In 2 to 3 business days. So I would say probably Monday, this video that was recorded will be posted there on our website. If you would like a copy of the PowerPoint slides, just shoot me over an email and I will respond back with the slides. So if anybody else has any questions for Marie, go ahead and place those in the chat on Teams. I will read the questions to her and she will do her best to respond.
And one of the things that Accurate has done very well is that any manager that has questions, they can send them to Marissa or Lisa, and if we're able to answer them for you or try to find the answers, they do a nice job of getting back to you.
Yes.